Good afternoon, everyone. It's 30 past 1, so I propose to start. I think more people will join, but I will start with the normal short introduction about Tuesday Connect, and then I will give the floor to Sofia and Moira and Vilhelm. So just keep in mind that this meeting will be recorded. So if you don't want to be recorded, just turn off your camera and do not turn it on when you ask question. And the meeting will be made available on the EU-JAMRAI YouTube channel after the meeting. Some housekeeping rules. Please help us moderating the Q&A session. And for that, add your name and institution in your name tag. It will make it easier for us to introduce you. Please mute yourself when not speaking. And if you want to intervene during the Q&A session, just raise your hand and we will give you the floor. And if possible, also turn on your camera unless you disagree to be recorded. So yeah, now I will give the floor to Work Package 8 team for the follow-up to our previous Tuesday Connect. So this time it's going to be about the human part and the integrated surveillance part. So Sofia, Vilhelm, and Moira. And thank you for presenting today. So I will stop sharing and now the floor is yours.
Thank you so much. So I'm just gonna share, let's see if I can find my way here. So now you see it in presentation mode, right?
Yes, perfect.
Perfect. Okay, thank you so much. So let's talk about One Health surveillance. And yes, my name is Sofia, and together with Lucy, I work as a work package leader for this part of the JAMRAI work. And as Johan said, we are going to focus on the human surveillance and the One Health surveillance today. So we have two teams here to help us get through this. But first of all, I just want to give you a little bit of an overview of our entire work package. And we have 25 partners that are involved in this work. And our partners are mainly national AMR surveillance experts that sits on different governmental agencies and expert laboratories and ministries and so on a national level. And since it's One Health, it's from the human side, the veterinary side, the environmental side, and so on. And our main stakeholders are European and UN agencies that work with the data that these systems provide. Yes, and one way to think about our work is to think about this JACRA approach, which is the largest One Health combined reporting that we have in Europe right now. So if we look at this report and look a bit at but what are the main gaps and how can we sort of work in JAMRAI to improve this sort of analysis and the data that's out there. And for humans, we definitely have good data on invasive infections, but we need to start to look at sort of other infections, what's there and what's sort of needed in order to expand to more other infections. For animals, we have good data on healthy animals, but we are really missing the diseased animals, and the network that we are building, EARSvet, is really addressing this. Same thing with the environmental part. We are working to build a network called EARS Environment, EARS Env, where we aim to do environmental surveillance together. And for the last part, like how do we combine all these different data sources and data into some sort of meaningful One Health analysis? So we have work ongoing on national integrated analysis and how to improve that. As Johan also mentioned, we had a thematic webinar in March where we talked about EARSvet and EARS Env. So today we're going to focus on the One Health, national One Health report work, and also the work we do on the humans, the human surveillance. So great. So let's start with the human part, which is all about strengthening the national surveillance systems on AMR in the human health sector. And I have Ville here somewhere to help me with this, a colleague. And I think we also have Amy and Baptiste, at least I saw Baptiste, that are also very, very, very much involved in this work to help us to sort of answer questions. Um, but yeah, so we're not going to focus on all of the work we're doing today on the human side, but we're going to focus on an inventory of national AMR surveillance systems that we are doing in JAMRAI 2 countries. And this inventory, it collects information about the systems and the content, but not the surveillance data itself. So what we're doing here is not a duplication of our international surveillance systems, such as EARSnet and GLASS, but about like information on the systems that provide information to those systems. But we have made this inventory, so we're going to talk a little bit about the content and the results from that inventory, and also about how we are working to visualize the inventory results in a dashboard. But first of all, why are we making this inventory? So right now we are really missing a joint compilation of national surveillance of AMR in one place. So having knowledge about this will really help us to collaborate. It will make us see like how are we different, how are we similar, and it will make us also be able to inspire each other. So, and there is a lot of data out there on this already, but it's not really in a format that allows us to do the sort of joint use and visualization and publication that we want to do. So that's why we really need to make the inventory. And the inventory, it's focused on national microbiological surveillance of AMR. And to the side here, you can see the bacterial pathogens that are part of this inventory, and also at the bottom, the culture materials. So what combines the pathogens is that they can all cause healthcare-associated infections and outbreaks. And we have collected this information via a questionnaire that we developed together with our partners and key stakeholders during fall 2024. And roughly you can divide the content of the questionnaire into 3 sections, where the first section is about national recommendations that is affecting AMR surveillance. The second part is about whole genome sequencing and how that is used at the National Reference Lab. And the third part is about the content and structure of the national AMR surveillance. And this is also the largest part of the inventory. Several of the questions have sort of also a legal perspective. That's something that we work on as well. And some of the questions are more there to sort of map gaps for capacity strengthening needs. But yeah, moving on to the results from the questionnaire. So starting with the participation. So right now we have 27 out of 30 countries in the entire JAMRAI consortia that have answered the questionnaire. So not only the ones that are partners in our work, but also several of the other countries have answered this. So thank you so much to everyone that has done this, because it's been quite a lot of work. And it gives us a 90% overall response rate, which is really great. And if you feel that you're part of one of these few countries that haven't answered yet, just get back to us and we will, if you want to answer, and we will fix that. But yeah, I'm just gonna like throw some of the data from the inventory on you and give some examples of what we have in this inventory. And from the first section that concerns the national guidance, we have, for instance, information on national guidance for empiric antibiotic treatment for common infections. So here you can see how many countries that have this sort of national recommendation in place, depending on divided on different infections. And we can see, for instance, that it's very common for countries to have national recommendations when it comes to lower respiratory tract infections, less common when we look at bloodstream infections. And this data is interesting to look at from several perspectives, but one of them is that from the EU Council recommendation, which is an important policy document that we work with implementing in JAMRAI, we have this recommendation that guidelines for treatment of common infection is something that we need to work more on. So here we have sort of a baseline, what it looks like right now in countries. For that recommendation. And another reason why we like to look at this data is because it really says, or it can say something about the use of your antimicrobial susceptibility data, because one way of using this data is that you sort of, well, use it to write treatment guidance that is helpful to sort of, treat your patients with good good antibiotics. The second example I want to show you is from the whole genome sequencing part, and this is about gaps in whole genome sequencing development. So countries were asked to fill like the main areas in need of development in the implementation and application of whole genome sequencing at the National Reference Lab. And here we can see, for instance, well, we know it's very common that funding is an issue both for human resources and for the infrastructure. But we can also see like capacity needs such as bioinformatics and data management, and data like this or like information like this is something we will use a little bit later on in our project to sort of when we start to work on capacity strengthening needs and projects. So the last example I want to show you is about the national surveillance information. And we have this for all the pathogens that I showed in the previous slide, but I chose to pick out the information for Klebsiella pneumoniae, that's carbapenem resistant, because this seems to be everyone's favorite pathogen right now. So you can see here in a graph how the countries have filled that they have national surveillance according to culture material. And it's also divided depending on if the surveillance is mandatory and voluntary. And we can see here that when it comes to blood and CFS, it's very common for countries to have that under mandatory surveillance. But as we move to sort of the other culture materials, it's less common to have it mandatory, and you have like more of the voluntary surveillance. And again, I just want to highlight that this is part of a recommendation that is also in the European Council recommendation that, and the recommendation is that pathogens resistant to last line treatment are notifiable under national legislation, which means basically that it's mandatory to do surveillance on them. And this is something that we have right now here, baseline data for that recommendation, how it looks like right now. But then you might say that, yeah, but does it really matter if it's mandatory or voluntary? Because it's not necessarily like an indicator for quality. No, you're absolutely right. And this is not the only data we have on this. We also have data on like, or information on what type of data is there on a national level, the population and the geographical coverage, and also the comparability. So from when we look at this data, we will be able to say a little bit on how does it matter if it's voluntary or mandatory, or how does that work for different countries? But yeah, and now I've just like thrown like 3 really quick examples of data from the questionnaire, and but the inventory and the questionnaire, it contains around 50 questions. So there's a lot more data here, and it's not really possible. I mean, as you know, from those of you working with AMR data, is that it very quickly becomes very, very complicated because there's so many pathogens and sample types and so on, and culture materials. So we really need like, we cannot look at this data in these sort of graphs. Like, we need another way to sort of visualize this to make it accessible to all of you and to all of us working with it. So I'm going to hand over to my colleague Ville to talk about how we plan to solve that accessibility.
Yes, thank you, Sofia. So I will tell you a bit more about why we're making a dashboard, on which principles we're building it, and also show you some first ever actually views of how it's actually shaping up. But first, some general considerations, starting with what the dashboard actually could visualize. And it's a lot if you think about it. I mean, circling back to what Sofia just mentioned, one example would be which AMR pathogens that are notifiable under mandatory surveillance in a country. Also, as shown, one can go more in depth, looking at urine or any other of the sample types surveyed, estimate the coverage and comparability of data between countries, and so on. Or why not then look at which partner countries that have national recommendations in place for many or some specific potentially infections. So the list could go on, and as Sofia said, there's a lot of data. So this is the idea, to visualize it in one place. So who is the dashboard for? Well, it will be public, so it's open to anyone. But the main target groups here would be people working with national surveillance, people working within the EU or UN agencies, as well as policy advisors. It's important to note that these groups all come from very different backgrounds with different amounts of knowledge, and they also have different interests. So therefore, when designing the dashboard, we're really focused and will continue to focus on simplicity and clarity without then losing depth and details, which is a mission impossible, one could say, but also a motivating challenge, we think. And briefly, before moving to the next slide, just some notes on the technical parts. So the dashboard is developed in R using R Shiny, which makes it open access and possible for anyone to use and to continue building upon. Moreover, the code will be open to the public via the GitHub repository we had made, and we plan to launch this dashboard in June now, 2025. Okay, so next slide, please. So now answering the potentially most important question, why make a dashboard? Well, we believe that a dashboard is perfectly suited to make complex data understandable and easy to access, and increase the availability of key information that many actors are interested in, well in line with the diverse set of stakeholders mentioned in the previous slide. We also see the dashboard as an important part in creating a collective memory, so to say, and accountability, providing a baseline for future development and making it possible to track projects in an efficient manner moving forward. Next slide. So before showing you some insights on how the dashboard looks, I just wanted to make some brief notes on how it's structured. So it mainly has two parts. One overview tab, which is centered around a map, where each country is colored based on the answers on each question and associated scores. Here it's also possible to filter the map in many dimensions, either one by one or many at the same time. So for example, it will be possible to filter the map and corresponding scores then based on a specific pathogen, sample type, and antibiotics. And this is the strength then with using a dashboard, that you can look at a lot of data and you can cut it in many different dimensions at the same time. The second part will consist of multiple tabs, which will allow more in-depth analysis of selected questions, but also to visualize questions that are not suitable for scoring. And speaking of score, Sofia, could you press once more? The reason we want to convert the answers for each question into a score is to enable visualization of multiple questions and areas simultaneously, not only to focus then on one question at the time. And this allows for more complex analysis to be done at the same time as it makes the information much more accessible. So please note, and I cannot stress this enough, I think, that scores are not designed to rank countries, but rather allow each country to see its strength and where there's room for improvements. We also hope that it could act as an additional argument when discussing with decision makers and try to motivate how to increase funding for AMR surveillance in individual countries. And the way it works, very briefly, is that each question has a coefficient. You could call it a weight, which alters how much a question should be counted to the overall score. So each answer on each question has a score associated to it. And by multiplying this coefficient and score of the selected answer doing so for each question and summing it all up, and then normalizing it with the maximum score, you will end up with a final score between 0 and 1. A score which then will be recalculated based on which filters to use. And I believe we will have many reasons to revisit what I just said at later occasions. I also want to say that for now, all these coefficients that rank the questions are set to 1. No optimization has been done yet, and that is because we want to do it together within JAMRAI, not ourselves. Transparency is also key, I would say, when creating such a dashboard. This means that the accompanying information besides the dashboard then will be the data set of the raw data exports, which the dashboard is based on, the scoring matrix, and the code for calculating the scores. Okay, Sofia, enough talking about the dashboard. Let's show it. So with respect to time, we will only be showing a few screenshots, but later we're planning to make a live demonstration. And in the end, it will be publicly available via the web, as said previously. So what do you see? Below the beautiful JAMRAI logo to the top right, you can see the filters and the different categories, which can be used then to recolor the map based on how you wish to cut the data set. The map itself is a map of Europe with a scale to the right, here displaying the total score then between 0 and 1 for each country. And please, again, this is at a very early stage, so don't take the numbers or colors here as definitive values at present. Next slide, please. So here are 4 different screenshots. The top right is the same one as before, and the other 3 shows the map colored based on different sections of the survey instead, such as AST and whole genome sequencing. So you can see it differs a bit between countries based on which section of the survey and which part of surveillance system we're actually looking at. And again, please focus on the conceptual idea rather than the exact color of your country. Okay, next slide. Yes, I also wanted to just comment on the completeness of the answers in the survey. So for some questions, a country might have answered do not know, and that is what this map reflects. So as you can see, overall, we were very happy to see that a very high degree of the questions actually were answered in all of the countries. Here calculated as the maximum score that a country could obtain based on what they actually answered, divided by the maximum score of the whole survey. And as a side note, when calculating the score in previous slides, each country's score is divided by the unique maximum score that that country could obtain based on which questions they actually answered. In other words, questions not answered would not affect the overall score. Okay, so the next and final slide. Trying to summarize a bit, we're aiming as part of our task in JAMRAI to develop the concept and content of a dashboard. We're aiming to do so by completing 2 full development cycles, which means that a second round of the survey will be coming in coming years. For sustainability, we're having discussions with partners about long-term hosting. However, I think, or we believe at least, that by documenting the survey and the dashboard properly, sharing the code, all related data, and making it publicly available, or at least, opening doors for future use rather than closing them. Okay, Sofia, back to you and potential questions on what we just said.
Yeah, I just need to unmute myself. Yeah, I'm not sure if there are any questions. Like I cannot see the chat right now, but otherwise I think we might we can move on to you, Moira, and we can also take like if you have any question, just like write them in the chat and we can address them at the end. So yeah, I think I will just hand over to you now, Moira.
Perfect. Yeah, next slide, please.
Wait, why did this? There.
Perfect. Yeah, so I'm going to be presenting our work in Work Package 8.4, which is trying to support countries in developing integrated national surveillance of AMR. And I'm leading this task along with Peter Jan, also from Belgium, Lucy, who is here and from France, and Sylvain, also from France. Next slide, please. Great. So today I'm going to present three main topics. First of all, why do we need integrated One Health surveillance? Hopefully I'll be able to convince you of the additional value, which is something we've been talking about a lot. I'm going to present our results from year one, which are looking at what does European One Health surveillance of AMR look like today. And we've already performed a mapping exercise in each country and a SWOT analysis of the current surveillance systems. And then looking to the future, so everything below the dotted line is the things we haven't yet done. So we're working on. We're using the One Health EpiCap tool, which I'll briefly present, and then looking towards what we think, One Health surveillance of AMR should look like. So how we're developing updated key indicators and supporting countries in developing national One Health reports and interactive dashboards. Next slide, please. So why do we need integrated One Health surveillance? Well, the surveillance landscape is really fragmented, even within a single country. You normally have lots of different actors who are managing different surveillance programs that have different goals. On the left-hand side here, you can see just some of the reports that are produced each year in Belgium that contain data on antimicrobial resistance and consumption. And each of these reports can be very long. It can be really hard to find all of the data or the information you need. And so hopefully by bringing together the most important data from each of these surveillance programs into one place, so in Belgium we have the BELMAP, the One Health report for AMR, the goal is really to provide a clear overview and to present these results using a common language, so sort of common indicators, to really be able to get an overview of what's going on in terms of antimicrobial resistance and consumption. And it also has a second key bonus value, which is that, when you bring together this data, you don't just bring together the data, you also have to bring together all of the people producing this data. So on the right-hand side here, you can see the people who contribute to our One Health report in Belgium. And all of these people come from different expertise, they come from different competencies. And by bringing together, all of these skills, all of this knowledge, together with the most important data, the clear overview of what's happening, you can develop, really clear communications around AMR. You can agree upon recommendations and priorities, and hopefully you can really support effective policy around antimicrobial resistance. Next slide, please. And of course, we don't want to just, put all of these reports side by side, make massive, huge PDFs that just contain all of the information. We don't want to have a JSON reporting. We really want to develop integrated reporting. And one of the questions that we've had a lot, that we've discussing a lot within our work package is what additional value can One Health surveillance have, and how can we develop surveillance systems that really provide these additional values? So we've discussed it within our group and also with other stakeholders, with policymakers, and sort of some of the key added values that we want to aim towards are early detection. So early detection of development of resistance or worrying patterns in different sectors. Hopefully these systems should be able to identify high risk areas, which also allows you to target your interventions. Ideally, they might help us to better understand the transmission of development of AMR, which, in a lot of sectors, in a lot of systems, we really don't understand. And also by bringing together people from these different disciplines, we hope to be able to increase efficiency. Because of course, in some sectors, we already have very well developed surveillance systems. In others, there are massive gaps. And if we can learn from each other, hopefully, we can improve our surveillance with, in a much more efficient manner than trying to work in isolation. Next slide, please. So how are we going to do this? How are we going to support countries to develop these networks and these reports? Well, we think there are two sort of important steps. The first step is really to understand what the surveillance system looks like today. And again, the dotted line represents where we are. So everything above it we've done. We've done this mapping exercise where each country has identified what data and programs are active in their country that they can include in their One Health report and who's running them. So who should be included in this One Health network. Next slide, please. And that's what I'm going to present first of all. So in year one, we performed this mapping exercise where with our participants, we developed a questionnaire which essentially allowed one coordinator in each country to send out the questionnaire to the people running the surveillance programs and collect data on what programs are active, who's running them, and also important information in terms of working out what can be included in the One Health report. So What's the data availability? Is it open access? Is it mandatory or voluntary? Do they report on whole genome sequencing, etc. And while we did provide a structured questionnaire and we did provide a common template for the results, so on the right-hand side here, you can see the matrix for Belgium, where you can see all of the surveillance programs that are active in the various sectors. A key difference between Work Package 8.4 and the questionnaires, for example, that Sofia was talking about, is that we're not trying to collect a EU-JAMRAI-wide data set. We're not trying to make a European-wide data set. We're actually supporting countries in collecting their own data, in developing their own surveillance system network. And so while we did provide formats, each country was able to adapt that and adapt the scope and the data that they collected according to their national situation. So the goal is really to support countries to do this within their own system. Next slide, please. So at the end of year one, we brought together all of these coordinators at a workshop in Brussels. And day one was really all about better understanding where we are now. So each person was able to, discuss the results from this mapping exercise and their experience. We'd also asked each country to perform a SWOT analysis outline the strengths, weaknesses, opportunities, and threats of their One Health surveillance landscape. We discussed this and also did a sort of a group-wide SWOT analysis of the One Health surveillance landscape in Europe, and I'll present some results from this in the next couple of slides. And day two was really all about looking to the future and what we want One Health surveillance to look like. And so we had presentations from organizations with established One Health AMR reports. We also had panel discussion with policymakers to try to get their input on what they would like to be included in these One Health reports and how we can best produce reports that are useful and accessible for them. And we started this discussion of identifying or agreeing upon new key indicators. And we hope to bring these things together in a white paper, which will really be about One Health AMR surveillance in Europe. Where are we today and where do we want to be tomorrow? And I'll present some of our results and the process we're going through in the next couple of slides. Next slide, please. So first of all, what does the One Health surveillance system look like in our participating countries? So we have some preliminary results. This data is we have results from 14 of the 16 countries. The other 2 countries are still waiting for some questionnaires, so they're still actively involved. And like I said, this is very preliminary, but what we really see is that we have very varied setups. So for example, when you look at the number of active surveillance programs across all 3 sectors, in some countries this can be as few as 4. In other countries, it can be up to 48 surveillance programs. It's worth noting this doesn't mean that necessarily there's better coverage when you have more surveillance programs. It might just be that it's more fragmented, but it's interesting to see the organization is really different in the different countries that we're working with. We also see a real range in how the programs are run, how they're governed, how they work. So, for example, in some countries, all of the programs are voluntary. In other countries, none of the programs are voluntary. When we look at the reporting to supranational programs like European-wide programs, in some countries, actually all of the systems only really collect the data for the European programs, and so their methodology is really set by these. In other countries, actually that only makes up 20%, and 80% of them are really just working at a national level. And so, it's a very varied landscape. We do see some patterns, especially in terms of coverage. So in most countries, we have some coverage or some surveillance within the human hospital sector, and within food producing animals, both in terms of resistance data and consumption data. But actually, most countries have no data in terms of community care, companion animals, sick animals, and the environment. And these are really large gaps in the majority of countries that are involved in our work package. And when we look at which countries already have a One Health report, so 9 of the 14 countries that have reported so far already have a One Health report. In quite a few of these, their first report was actually last year, so they've had their first report while already participating in EU-JAMRAI. So, a lot of our work is not just about supporting the production of a first report, but hopefully improving upon these reports. Next slide, please. And like I said, another task that we did was this SWOT analysis of the current surveillance system. So whilst each country did a SWOT analysis of their individual system, we also came together to have a discussion as a whole work package. And we divided this into the strengths, weaknesses, opportunities, and threats to the coverage, to governance, to interoperability, and what they call the 4 Cs of One Healthness. So communication, coordination, collaboration, and capacity building. And I'm not going to read through the results. I've put a brief summary on this slide, so if you want to come back to it, you can read this slide after the presentation. But we definitely see some patterns. So, for example, in terms of coverage, we see the strengths tend to be the same in most countries, but we do see some real differences. For example, some countries really listed legislation as a strength because they said a lot of their programs are mandatory, and so they had a very strong mandate for collecting the data. And other countries said that actually legislation can be a real weakness and a threat because if, for example, like data protection legislation can make it very difficult to collect the data that they need. So it was really interesting to see what was really in common across Europe and actually the big differences that we observed as well. Next slide, please. So that's where we are, and those are the results we've collected so far. Looking to the future, so this year, our sort of current task is to assess the One Healthness of the landscapes within each country and work out how we can build the capacity of their One Health network. And to do that, we're going to use the One Health EpiCap tool, which I'll present briefly in the next slide. And then in years 3 and 4, we're really hoping to support countries in developing their One Health report. And like I said, a lot of this is also about improving the reporting of data in countries that already have reports, or overall, we want to obviously produce useful reports. And so we're looking at developing interactive dashboards, integrated analyses, and selecting these common primary and secondary indicators. And I also have a slide just about the process we're going through to select these indicators. Next slide, please. So first of all, this year, each country is going to have to use the One Health EpiCap tool to do a One Healthness assessment of their surveillance landscape. And this is where each coordinator within a country will make a panel of 8 to 12 panelists that hopefully covers all of the sectors. And then basically the app supports a discussion to allow this panel to come to a consensus in terms of the One Health capacity of their surveillance system in terms of organization, operation, and impact. And you put the results, this consensus, into the application, and it outputs diagnostics of the strengths and weaknesses. And basically, between these diagnostics and all of the discussion that allowed you to reach this consensus, the output is concrete actions and suggestions for how to reinforce collaborations and how to build your One Health capacity within your surveillance landscape, what to prioritize first. Next slide, please. And the other main task that we're working on this year is selecting these key indicators. So like I said, we need a common language. We need to get a clear overview of the most important data. So one of the things we're doing is trying to select some key indicators that can hopefully be reported in most countries. And we're starting off with the list of indicators from human and veterinary AMR and AMC, which was published by the ECDC, EFSA, and EMA in 2017. In that report, they said it should be updated every 5 years, and we agree it's time for an update. So that's one of our tasks this year. And we're hoping to also add some environmental indicators, which we're going to work closely with Work Package 8.3 to develop with them. So the way that we're hoping to approach this is we're putting together a working group. We've outlined some key core competencies, which we're sharing with our work package to try to make sure that all of the sectors and all of the core competencies are covered within this working group. This working group's going to then make a proposal for the selected indicators. And then we're basically going to put that selection of indicators out for external validation. So to the wider Work Package 8.4 participants, also to the wider EU-JAMRAI community, especially within Work Package 8, so within the human, veterinary, and environmental surveillance sectors, and also hopefully from some external groups, so from some of the people in the groups that developed the 2017 list, but also from the quadripartite group that's working on integrated surveillance. So we're hoping to get a lot of external validation of these indicators and make sure that, everyone agrees that will give us a sort of clear overview of the most important information. And so that's really an idea of where we are now and these two tasks that we're aiming on, really working on in this year, in 2025. So I think the next slide is just the question slide. So I don't know if there have been any questions in the chat while we've been talking.
Well, we actually had one, but Lucy just answered to it in
perfect.
the chat.
Oh, that's thanks, Lucy. Very efficient.
Just let us know. The question was about whether we would make our tools available for countries not involved in 8.4 activities to perform their own situation analysis. So I said that, we can definitely make the questionnaire available. This could be easily done since we have a template we have been sharing with our partners. And the second tool, the One Health Epic app, is already public. So I shared the link to the app, the Shiny app, where people can find more information about the tool and so on.
I think when we publish the white paper, we can definitely share the questionnaire as one of the appendices or something, so it's clear. Also, just from a transparency of our methodology and things, so it will definitely be publicly available.
Christine, do you want to take the floor to ask your question?
Just maybe a naive question, apologies. I was just curious if, it sounds really interesting. It will be amazing to get integrated surveillance like this. But I was just wondering if there was any kind of effort as well to expedite the surveillance so that it could be used in outbreak detection and prevention. So it's more up to date.
Yeah, I think it's a very good question. I think certainly when we talk to our partners in the various countries, it's definitely something that's being developed within certain countries. Like I know within Belgium, we're really trying to work on this, and yeah, the surveillance of outbreaks and reporting of outbreak data for us in Belgium is quite complicated. I can imagine in other countries it's also similar. In terms of Work Package 8.4, one of the big benefits of the work package is that, obviously we want to learn from each other. We have this network and we're certainly trying to, support that. But I think in terms of developing outbreak specific, well, sort of expediting surveillance to be able to support outbreaks. In some countries, they're not that far away. In some countries, they're maybe quite far away from that. And whilst we're trying to support countries within their own system, we're not developing like a European-wide system to be able to support outbreak surveillance, if that makes sense. So whilst I think it's a fantastic goal, I think in some countries, I know it's definitely sort of a target within some national systems, but I think it's a little bit outside of our scope of Work Package 8.4 to be able to support countries in doing that. But hopefully, yeah, within our network, we can again increase the efficiency. If there are countries that have developed effective systems for this, then hopefully we can learn from each other and mean that it can be developed quicker in other countries.
Yeah, we actually did try in JAMRAI 1 also to have surveillance data updated on a regular basis all around Europe. But we realized that it was quite complicated. And as Moira said, situation differ between countries. So it's achievable in some countries, but in others, it's just impossible at the moment. So yeah, we did try in JAMRAI 1. So we have time for more questions. So if anybody want to ask a question in the chat or raise their hand. In the meantime, I would just like to acknowledge you all for your amazing work, because surveillance is a complex environment with many initiatives going on. And it's sometimes difficult to bring added value to an overcrowded space. So I think you are doing great, and I really found your results amazing. Looking forward to the future, and I think you can bring a lot of added value to the field. So thank you for that and for your hard work, and also to the partners for contributing. Any question? No, I think people are a bit shy. Well, it was also really clear. I have to say that the presentation was the two presentations were really clear. Okay, so I think we can just conclude. So I have one last slide to share for the next rendezvous. Well, our next Tuesday Connect will be on May, on the 20th of May, and the idea is to bring external stakeholders. So we started our Tuesday Connect in January, and for now we only had presentation from work package leader and task leaders. So now we would like to open the floor to stakeholders to present. So yeah, we're in discussion with different stakeholders at the moment. So yeah, we will share more information on who will present in May. So stay tuned for more information. And well, if you want to request time to present during a Tuesday Connect, just contact us using our secretariat address. So thank you all for joining. And thank you also to Sofia, Vilhelm, and Moira for excellent presentation and for your amazing work and for the whole work package 8 in general.